Hello friends, I am Dr. Narari Pofri. I have started this Physiology Matters channel. बहुत बार स्टूडेंट्स आते हैं और पूछते हैं कि सर एग्ज़ाम के लिए कौन सी बुक पढ़े, क्या पढ़े, उसमें आंसर्स कैसे लिखे, क्योंकि जितने भी फिजियोलॉजी बुक्स है उसमें थियरी बहुत ज़्यादा होती है एंड पर्टिकुलर आंसर क्या लिखना है वो कुछ स्पेसिफिकली नहीं दिया रहता है. So for this reason I have started this Physiology Matters channel. I am going to post regular videos on important topics in physiology where I am going to explain how to write answers of the important questions on those topics. So I am starting with cardiovascular system, and the first video I am posting on cardiac cycle. Hello friends, welcome to Physiology Matters. I am Dr. Narari Pofri, and in this video we will learn about the definition and various phases in cardiac cycle. First we will see definition of a cardiac cycle. So the electrical and mechanical events that occur from beginning of one heartbeat to the beginning of the next is called as the cardiac cycle. Now here in between the two heartbeats there are electrical and mechanical events. So electrical events, they are related to the action potential, that is depolarization, repolarization, and in mechanical events these are the contraction and relaxation of the cardiac muscles. Now this whole of the cardiac cycle, its duration, its total duration is 0.8 second, and this cardiac cycle, it is in atria as well as ventricles. So atrial cycle and ventricular cycle. Atrial cycle, it consists of atrial systole and atrial diastole. Ventricular cycle, it consists of ventricular systole and ventricular diastole. Duration of both atrial as well as ventricular cycle is 0.8 second. Okay, and this atrial systole, it is 0.1 second and atrial diastole is 0.7 second. So duration of the atrial diastole is more here, and in ventricular cycle ventricular systole is 0.3, diastole is 0.5 second. Here again the duration of the ventricular diastole is more as compared to the ventricular systole. Okay, so now which are the various phases in cardiac cycle? So there are atrial events and ventricular events. Okay, so atrial events are atrial systole, atrial diastole. Ventricular events are ventricular systole, ventricular diastole. Now ventricular systole is again it is having phases. So the first phase is isometric contraction phase. Second one is the ejection phase. Now this ejection phase, it is again rapid ejection phase and slow ejection phase. In diastole, the first phase is proto diastole, second one is isometric relaxation phase, and the third one is the filling phase. Now again this filling phase, depending on the duration, it is divided into the first rapid filling phase in the first 1/3, second third diastasis, and the last rapid phase, it is in the third phase. Okay, so now we will see in detail about these various phases. Okay, so the first one, the atrial events. In atrial events, now let's see the atrial events. So the first one is atrial systole, second one is atrial diastole. Duration of the atrial systole is 0.1 second and duration of the atrial diastole is 0.7 seconds. Now this atrial systole, this is the first phase of cardiac cycle. So cardiac cycle starts with the atrial systole. So why? Because the SA node, it is situated in the right atrium. So SA node is the pacemaker, the cardiac impulse, it is generated at the SA node, so it goes to the atrium first. So that's why the atrial systole, this is the first phase in the atrial cycle, that is in the cardiac cycle, basically the cardiac cycle. Now this atrial systole, it is followed by atrial diastole, and during atrial systole the atria contracts and expels the blood into the ventricles. Now if we will divide
this atrial systole into two half, that is the first half and the second half duration of the atrial systole. The first half duration, in this duration the force of contraction of the cardiac muscles is more as compared to the second half. Why? Due to the increase or high intra-arterial pressure. So in the first half of the atrial systole, the intra-arterial pressure is more or high, so that's why the force of atrial contraction is stronger in the first half as compared to the second one. Okay, now the second phase, that is the atrial diastole. So atrial diastole, it comes after the atrial systole, and in this phase atria relax and they receive blood from the great veins. So and this right atrium, it receives blood from the superior vena cava, inferior vena cava, and the left atrium, it receives blood from the pulmonary veins. Now this atrial systole and diastole, they alternately follow each other and forms the atrial cycle. Okay, so it forms the atrial cycle. So atrial systole, after that atrial diastole, again atrial systole will start. Okay, so this is about the atrial events. Now next are the ventricular events. Ventricular events. Now we will learn this these ventricular events by this diagram. Okay, so the first one, this is the first one. So here we will start these ventricular events with the first phase of the isometric contraction phase. Okay, now before this isometric contraction phase, there is a last rapid filling phase. Okay, during which the atrial systole is there. The blood, it is poured from the left atrium into the left ventricle. Okay, so and these atrioventricular valves are open there for in case of the last rapid filling phase. Now when the left atrium, it empties its blood into the left ventricle, what happens? The pressure inside the left atrium, it decreases, and as the left ventricle, it gets filled with the blood, the pressure inside the left ventricle, it will increase. So it will push the atrioventricular walls. So open, these open atrioventricular walls, they will got closed. Okay, so here in isometric contraction, the atrioventricular walls will be closed. Okay, so atrioventricular walls will be closed. So this wall is also, this will also be closed on both the sides. We will see basically the left side. Okay, same events are happening on the right side also, that is the right atrium, this right atrium and right ventricle. Same events are occurring on the right side, but we will just for our convenience, we will see left side. So this atrioventricular walls, they are closed, and these semilunar walls, they are also closed there. Okay, so semilunar walls are also closed. So in the first phase, as the pressure inside the left atrium, it will increase, it will push so in this first phase, that is isovolumetric contraction phase, the name, that is isovolumetric, so there is no change in the volume. Okay, so here all the four walls are closed, that is both atrioventricular walls and both semilunar walls, they are closed. Okay, but the pressure inside the ventricle is increasing. So pressure is increasing continuously, there is no change in the volume. The cardiac muscle length of the cardiac muscle remains same. So length of the cardiac muscle is same, volume is same, but pressure is increased. So that's why it is called as isovolumetric contraction phase. Another name is isometric contraction phase. Okay, so this is the first phase of the atrial systole basically. So here this phase starts with the atrioventricular wall closure and it ends with the opening of the semilunar wall. Now this opening of the semilunar wall, it basically starts the ejection phase. Okay, now here in this phase, isovolumetric contraction phase, atria are relaxed phase, and ventricles, they are in a phase of contraction, so they contract. So ventricles contract and atria are relaxed. Then AV wall and semilunar wall, they are closed, that is all the four walls are closed. The time duration for this phase is 0.05 second, and the closure of the AV wall, it produces the sound which is called as the first heart sound. So during this phase, the first heart sound is heard. Okay, so this is about the isovolumetric contraction phase. Now as there is increase in the pressure inside the left ventricle, okay, now when the pressure inside the left ventricle, it will become more as compared to the pressure inside the aorta. Okay, so it will push the semilunar walls. So in the second diagram we can see it will push the semilunar wall, and this aortic wall, it will get open. So due to increase in the pressure inside the left ventricle, so these walls will be closed here. Okay, so atrioventricular walls will be closed and these semilunar walls will become open. Okay, so they will get open here, so blood will flow through the pulmonary artery and the aorta during this contraction phase. Now this is the second phase, that is the ejection phase. Okay, so this is the ejection phase. So during this there will be a contraction of the muscles, these cardiac muscles, they will contract, and the size of the ventricles. Okay, so they will contract there, so they will show contraction, and length it will change. So ejection phase, here pressure inside the left ventricle will increase, it will become more than the aorta, and thus it will push the semilunar walls, that is the aortic wall, and the blood will get ejected from left ventricle into the aorta. Okay, same with the right ventricle and the pulmonary artery. Okay, blood, it will push the pulmonary walls, and it will rapidly flow from right ventricle into the pulmonary artery. Now this ejection phase, it is of two types. The number one is the rapid ejection phase, and the second one is the slow ejection phase. The rapid ejection phase, 70% of the blood, it will be pushed through these walls into the aorta and pulmonary artery by this rapid ejection phase, and slow ejection phase, remaining 30% of the blood is poured there. Okay, so this is the second phase, that is the ejection phase. Again, during this ejection phase, the starting is opening of the semilunar walls, and it ends with the closure of the semilunar walls. Now ending, that is the closure of the semilunar wall, it is the starting of the isometric relaxation phase or the diastole phase. Basically the diastolic phase, it is the starting, so that's why this is the end point. Now atria will in this phase, atria will be in a relaxed state, and ventricles, they will be in a phase of contraction, so they will contract here, and the atrioventricular walls are closed here, and semilunar walls, they are in open state. The total time duration taken by this phase, that is the ventricular ejection phase, is 0.25 seconds. Okay, so now the next phase, the third one. So here in ejection phase, the pressure inside the ventricle is increased, and it has pushed the blood inside the aorta. Now the blood inside the ventricle as its amount is decreased, its volume is decreased, so pressure inside the ventricle will fall now. Okay, so it will fall to the level where the aortic pressure will become just more than the ventricular pressure, left ventricular pressure. So in that, at that time, what will happen, the blood which is there inside the aorta, it will return back. Okay, so due to this, what will happen, the walls which are there, that is the aortic walls, so these aortic walls, they will close now. So this aortic wall will close. Why? Due to the rapid rushing of the blood from aorta inside the ventricle, these walls, aortic wall, they will close. Now this atrioventricular walls, they are already closed, and these walls are now closed. Now during this phase, there is just a time lag where the ventricle, they start diastole, that is the relaxation, and the aortic or the semilunar walls, they are not closed yet, they are in open state, but they are not completely closed. So in between that duration, there is a phase which is called as the proto diastole. So this proto diastole is the phase between the just starting of diastole, that is the relaxation of the ventricular muscle has start, and the closure of the semilunar walls. So this is the proto diastole phase. Now after this proto diastole phase, in this the next stage, next phase, it is the isovolumetric relaxation phase. Isovolumetric relaxation phase. Now here again, as the name suggests, isovolumetric, so there is no change in the volume, no change in the cardiac muscle length. So here and there is a relaxation of the cardiac muscles. So here pressure inside the ventricle, so here we are seeing left ventricle, so left ventricle pressure is decreasing continuously. Okay, in the right ventricle also pressure is decreasing, and but here, as the walls are closed, all the four walls are closed here, so the volume or the cardiac muscle length, it is same, or there is no change in the cardiac muscle length. So this is called as isovolumetric relaxation. Okay, so now in this phase, it starts with the closure of semilunar wall, and there is a opening of the AV walls where this phase it ends. Okay, here in this phase, atria, they are in a relaxed position, and ventricles, they are also in a relaxed position. All the four walls, they are in closed position, and here the second heart sound is heard. Okay, so second heart sound means the closure of the semilunar walls, so it is heard here in this isovolumetric relaxation phase. Second heart sound is heard. Okay, so this is the third one. Now the fourth one, fourth condition. Here so here atria, it is receiving continuous blood from the great veins. So here the amount of blood, that is the volume of the blood inside the atria, it is increased as compared to the ventricle, so that's why the pressure is also increased. So due to increase in pressure inside the atria, that is more just as compared to the ventricles, this atrioventricular wall, they will open. Okay, so this atrioventricular walls, they will open, and blood will flow from the atrium inside the ventricle. This semilunar walls will be in a closed position. So blood is flowing from atrium into the ventricle. Okay, and there is opening of the atrioventricular wall. Now this filling phase, this is called as filling phase. So this filling phase, it is again having three phases. The first one is called as the first rapid filling phase, the second one is called as the diastasis, and the third one is called as the last rapid filling phase. So maximum blood which is accumulated inside the atrium, it it rushes to the ventricle in this first rapid filling phase. Okay, maximum of the blood it reaches to the ventricle in first rapid filling phase. So diastasis, it is in the second third of the filling phase. Here the blood which is coming directly from the greater veins, they pass through the atrium and it goes directly into the ventricles. So these greater veins, they pour blood directly into the ventricles through atrium. So this phase is the phase of diastasis. And the last rapid filling phase, so the fifth one, this is the last rapid filling phase. Now in this phase there is atrial contraction. So atria will contract in this phase and it will pour blood. So here again in this phase also atrioventricular valves are open. So atria will pour blood, that is around 20% of the blood which ventricles received in this filling phase, it comes from the during the last rapid filling phase. So here the blood which is coming from atria, it is due to the atrial contraction. So here it is the only phase where the atria are in a phase of contraction, that is atrial systole is there. So atria are contracted here. Okay, so they are having a contraction there and ventricles are in a phase of relaxation. So here in the last rapid filling phase, atrioventricular valves are open and semilunar valves are closed. So this filling phase, it starts with the opening of the AV valves and it ends with the closure of the AV valve. Now when again we are coming to the first step, that is after last rapid filling phase, these AV valves, they are open here. Okay, so blood which is coming continuously inside the ventricle, so this ventricle will become full of blood. Okay, so it will increase the pressure inside the ventricle. So when it will become more as compared to the atrium, this atrioventricular wall, it will close and it will start again the isovolumetric contraction phase. Okay, so here in the rapid filling phase, that is the first rapid filling phase, the atria are relaxed, but in last rapid filling phase atria are in contracted stage. Ventricles are relaxed in relaxed state in both the phases. Then atrioventricular valves, they are in open state and semilunar valves, they are in closed state. So the third heart sound, it is heard during this first rapid filling phase. So third heart sound is heard during this first rapid filling phase, and last rapid filling phase the fourth heart sound is heard. Okay, and this will again start the isovolumetric contraction and this cycle will repeat again and again. So this is in short about the ventricular events which occur inside the ventricles. Okay, now I have prepared one table where I have tried to put all the major points of these ventricular events at one place. So we will see this table. So ventricular cycle, the first one, isometric contraction phase, that is isovolumetric contraction phase. So red color, these two phases, they are the contraction phase, and that is the systole, ventricular systole, and this blue colored are the relaxation or diastole phase. Okay, so the first one, isometric contraction phase, it starts with atrioventricular valve closure, ends with opening of the semilunar valves. Atria are relaxed, ventricles are contracted, AV valves are closed, semilunar valves are closed. The total time duration is 0.05 second. Pressure is increased here. Volume remains same. There is no change in the volume, and the first heart sound is heard during this isometric contraction phase. All these details we are just discussed, so that's why I am just overlooking this. The ventricular ejection phase, it will start with the opening of the semilunar valve. ends with closure of the semilunar wall. The atria are relaxed, ventricles are contracted, then AV walls are closed, semilunar walls are open. The time duration for this phase is 0.25 second. It is again divided into two phases, rapid and slow. Rapid ejection phase, it pours the 70% of blood into the systemic arteries, and slow ejection phase, it pours 30% of the remaining blood. Okay, then isometric relaxation phase, it starts with closure of semilunar wall, end with opening of the AV walls. Here atria are relaxed, okay, and ventricles are also relaxed. AV walls and semilunar wall, that is all the four walls are closed in closed state. Ventricles relax here, pressure is decreasing, volume is same, that is no change in the volume, and second heart sound is heard due to the closure of the semilunar walls. Now the first rapid filling phase, that is the total rapid filling phase, it starts with opening of the AV walls and ends with the AV wall closure. Okay, and in first rapid filling phase, atria are in relaxed state, ventricles are also relaxed, AV walls are open, and semilunar walls are closed. So it mainly it is having first third of the diastole, and third heart sound is heard during the first rapid filling phase. Now after first rapid filling phase, there is a diastasis, which we had seen. Diastasis, it is the second third A. Okay, out of the three parts, the second one, it is by this diastasis, where veins directly, the major veins, they directly pour blood into the ventricles through atria. Now the last rapid filling phase, here atria contracts, that is there is atrial systole. Okay, ventricles are relaxed, AV walls are open, and semilunar walls are closed state. Total time duration for this filling phase 0.5 second. Atrial systole in this last rapid filling phase, and fourth heart sound is heard during this last rapid filling phase. So if we will overlook this table, the atria, okay, so atria, they contract during the last rapid filling phase only. Okay, then during the systole, ventricles are in contracted stage, and in diastole they are in relaxed stage. Okay, now semilunar walls, this semilunar walls, they open only during the ventricular ejection phase, and they close at the end of this phase, or we can say the starting of the isometric relaxation phase. Okay, so these are some of the important major points which we have covered under this cardiac cycle. Okay, so this proto diastole, it is the interval between the beginning of the ventricular diastole and closure of the semilunar walls, and diastasis, the small amount of blood which is coming from the veins, it flows into the ventricle during middle third of the diastole. So we had seen these two things also. So this is all about the cardiac cycle, definition and phases of cardiac cycle. So so for your exams, this definition of cardiac cycle is important. Okay, then these durations can be asked as MCQ. Then cardiac phases, in LAQ, that is long answer question, these phases can be asked, that is enlist the various cardiac phases. It can be asked as BAQ, SAQ also. So enlist the various cardiac phases and explain one of them. Okay, so any of the phase can be asked to explain. So this is the atrial phase which you have to remember. Then if you will remember this mechanism, various pressure changes in these atria, ventricles, and how they are operating, then you will definitely be able to write the answers. So in cardiac cycle, what basically what is happening there? Okay, if you will consider the left ventricle, okay, and this is suppose atrioventricular wall, and this is semilunar wall. Okay, left ventricle, AV wall, and this is the aortic wall. Okay, aortic wall. So there is continuous opening closure of the atrioventricular wall, and then there is opening closure of the semilunar wall. Means first there is this AV wall, it opens, first it opens, then it gets closed. Then this aortic wall, then it opens and it gets closed. So this is the sequence: it open, it close, open, close, and in between this there are these various phases. Okay, so as in isovolumetric contraction, starting is with the closure of the this AV wall. Okay, so AV wall is closed during isovolumetric contraction phase. Then ejection phase, there is opening of the aortic wall. During ejection phase, end of the ejection phase is by closed, that is the closure of the this aortic wall. Okay, then again during the filling phase, there is opening of the atrioventricular wall, and at the end of last rapid filling phase, there is closure of the atrioventricular wall. So there is opening of the AV wall, closure of the AV wall, opening of the semilunar wall, closure of the semilunar wall. That's how this cardiac cycle is operating. Okay, so you have to remember these mechanisms, and you have to remember this table. In this table, for each of the phase, the points are given here. If you will write in your exams point wise all these points, you will definitely get a good marks. And other features I have enumerated there in the last column, and you can add your points also there, okay, in that answer. So you will get good marks if you will write all these points in your answer. So thanks for watching this video, and keep watching my videos. Please subscribe to the Physiology Matters. I am going to bring more videos related to the physiology for first year MBBS students. So that's all for now. So thanks for watching this video, and thank you.